Hi and welcome to the DE Physical Education Flip Learning videos. Injuries in sport, prevention, identification and treatment. Identification of an injury. Sports injuries can be caused by a fall or a heavy blow, failing to warm up, using equipment properly or using the correct technique, or simply by pushing yourself too hard. While injuries are not inevitable, it is very rare for someone involved in physical activity to remain injury-free throughout their lives. There are 6 types of injuries you need to know for your GCSE: concussion, fractures, dislocations, soft tissue injuries, sprains, and torn cartilage. Concussion. Concussion is defined by the sudden but short-lived loss of mental function that occurs after a blow or other head injury. Concussion is the least serious type of brain injury, but could be masking something more serious, like a bleed in the brain or swelling of the brain. Therefore, you should always seek medical help if you receive a blow or other injury to the head. Some of the symptoms: headaches, dizziness, nausea, seeing stars or having blurry vision, unconsciousness, confusion immediately after the injury, or temporary loss of memory. Fracture. A fracture is a broken bone. There are 2 types of fractures: open and closed. Just to make you aware, the following pictures are a little bit graphic. Open fracture. An open fracture where the bone penetrates the skin, and a closed fracture is where the bone does not penetrate the skin. The symptoms of a closed fracture include bruising, swelling, deformity, and pain, especially if you're trying to put weight on the site of an injury. For an open fracture, the symptoms are quite obvious as the bone will be penetrating the skin. Dislocation. Bones are dislocated at the joint. It can be difficult to work out if the bone is broken or dislocated, so it is important to seek medical help as early opportunity. Some of the symptoms: deformity, swelling, bruising, numbness, pain, especially when you're trying to put weight on the site of the injury. Soft tissue injuries. There are 4 main types of soft tissue injury: a strain, usually to the muscle or tendon, tennis elbow, golfer's elbow, and abrasions to the skin. Soft tissue injuries are injuries to the muscles, ligaments, and tendons. Strains. The connective tissue that connects tissues that attaches muscle to bone is stretched too much or tears. Symptoms of a strain: pain, swelling, bruising, muscle spasm. Tennis elbow. This is an overuse injury caused by overusing the muscles and tendons attached to the elbow and is used to straighten the wrist. Some symptoms are pain on the outside or upper forearm when flexing the forearm, gripping or swinging. This is not just associated to tennis, however, it is referred to as tennis elbow. Golfer's elbow is a very similar one. This is an overuse injury caused by overusing the muscles and tendons attached to your elbow using to straighten the wrist. The symptoms are the same as tennis elbow, but again, this is not just associated with golfing. So this is not just associated with a golf injury. Abrasions. Abrasions are caused when the layer of skin is rubbed off. Symptoms would be the area feels hot, a burning sensation, skin looks red raw, very little or no bleeding. For example, in the picture. It is also known as a graze. Sprain. When the ligament that attaches to the bone at the joint is stretched too much or tears. Symptoms: swelling, bruising, numbness, pain, especially if you're trying to put weight on the site of an injury. Torn cartilage. A partial or complete tear in the cartilage is a connective tissue. A partial or complete tear in the cartilage. The cartilage is a connective tissue found throughout the body. Here's an example from the knee. So this is the meniscus cartilage in between the knee, just around the patella. Symptoms: pain, swelling, stiffness, and a decreased range of movement. How to optimize training and avoid injury. Getting injured from playing sports or taking part in physical activity is not inevitable. However, if you follow the following 6 simple rules, these will help optimize your training and avoid injury. Training programs, rules, protective clothing, checking equipment, checking your facilities, warming up and cooling down. Training program. Make sure your training program is designed using the principles of training to avoid overuse injuries. Overuse injuries include tennis elbow and golfer's elbow. Rules. Make sure you understand and follow all the rules of an activity during play and participation. Protective clothing. Make sure you use appropriate protective clothing and equipment during play and participation. Check equipment. Always check equipment before you use them to make sure it is in good condition. Check the facilities. Always check facilities before you use them to make sure there are no hazards such as broken glass on the playing field. Warming up and cooling down. You must always make sure you warm up and cool down as this reduces your chances of becoming injured.